My name is Dr. David Krieger. I'm a neurosurgeon here in Ventura mostly, but also in this region. I work for the Neurosurgical Specialists of South Florida. I specialize in both brain and spine surgery. So it was actually very early on, when I was maybe 11 or 12. And at that time I was actually working, believe it or not, at 11 or 12, I was working in some laboratories at the Children's Hospital of Philadelphia. And I was working in a neurological laboratory. So I was working on some of the cells in the brain. And so that's what first got me interested. In terms of my particular practice, I do both brain and spine surgery, as I mentioned. I try to use cutting-edge techniques. So, for example, in my training, when I trained, we didn't use robotics, but that's something that I've incorporated into my practice. Anything that I can to help patients, I try to use. So even if it's not something that I've done before, I try to incorporate that into my practice. The purpose of a surgeon is to, from my perspective, is to guide people. So I'm not trying to force someone to do anything. I'm trying to give them my best opinion, and I'm trying to guide them to help them. I work particularly not only in elective spine surgery, both brain and spine, but I also do a lot of traumatic injuries. So I've done a lot of, for example, spinal cord injuries and a lot of brain injuries. There have been a lot of patients who have come in who have what are called very low GCS scores, meaning they've had very, very bad brain injuries. Some who are almost at the brink of death. Maybe if they waited another 15 minutes, they would have died. And then I see them a few months later, I'm thinking about one person in particular, and comes back, walks in, is completely normal. So, you know, going from someone who's literally almost dead and to someone who's normal in 3 months later.